Hello, welcome to Health Talk with Dr. Toyin. Today we'll be discussing menopause. Are you a woman between the ages of 40 to 55, or you have female relatives? If any of these apply to you, I think you should listen closely. Menopause by itself is a diagnosis that is taken in retrospect because it just means cessation of menstruation. For those more than 50 years old, you need to have 1 year of no menstruation. And for those less than 50 years old, you need to have 2 years of no menstruation. There is a journey to the menopause, which is called the perimenopause or the climacteric. Some factors that might make you go through the menopause include things like when a surgery is done to remove the ovaries. Also, if you have had chemotherapy or radiotherapy, you might go through the menopause at that time. We need to understand what happens in the normal female body to understand how we get to the menopause. At birth, on average, there are about 1.5 million eggs that a female child has in her body. By the time she reaches her first period, which is the menarche, a third of these eggs have been lost. On average, a woman goes through about 400 menstrual cycles within her reproductive career. At each menstrual cycle, 20 to 30 eggs can die off, and there might be some that actually get fertilized, and that is when you get pregnant. What happens in menopause? The ovaries fail and they don't produce as much estrogen and progesterone. Because of this, levels of the hormones called follicle stimulating hormone or FSH and luteinizing hormone or LH become elevated. Due to decreased progesterone levels, periods become irregular. The periods might also become irregular in that they come more often or the time between periods is greatly increased. And if you want to know more about periods, you can refer to my previous video. Some things that might temporarily increase the levels of FSH include after stopping the oral contraceptive pills or the depot injection, also during breastfeeding, and when the woman is taking some medications, for example, SSRIs or the selective serotonin reuptake inhibitors. You might ask yourself, what are the symptoms of menopause? Broadly speaking, they can be divided into physical, sexual, psychological, and others. The physical symptoms include things like hot flushes and sweats, and this is due to the failure of the temperature regulating process of the body. Other physical symptoms include things like headaches or dizziness and palpitations in the woman. The woman might also have problems sleeping due to these symptoms or even due to the sweats, which can occur at night, making her feel uncomfortable. She might have joint pains also due to a reduction in the bone mass. And this is why menopausal women are prone to fractures. The sexual factors are due to a reduction in estrogen especially, which leads to a thinning of the skin in the genital area. Due to this thinning, the woman might be prone to urine infections and she might tend to urinate more often due to the irritability of the dry skin in that area. Because the skin and the mucus is also dry, sexual intercourse might become painful. This might lead to low libido and ultimately lead to relationship problems. Psychological factors include things like low mood, irritability, lack of concentration. This, in addition to rearing either teenage or young adult children, might add to the psychological symptoms. Other symptoms include dry skin, which might itch a lot. The hair might also become thin and hair loss might increase. You might ask, do I need to do any blood tests to confirm that I've gone through the menopause? Technically speaking, if you're more than 45 years, no test is necessary unless you are on hormonal contraceptives. In that case, you might want to measure the FSH levels. In any case, to diagnose menopause, you need to measure the FSH levels and repeat in 4 to 6 weeks. If they are elevated, roughly a diagnosis of menopause can be made. If you are less than 45 years and you're having these symptoms, please ensure you have these blood tests done because things can be done to help you. Don't forget to watch this video again, share, and until next time, smile because it's healthy. Bye!